All right, let's jump right in. You've probably heard all the buzz about these new weight loss drugs. Well, on the surface, they seem to completely contradict a basic rule of metabolism. It presents a paradox that, honestly, is a real head scratcher. Yeah, exactly. This is the core of the paradox. We're told these drugs, the GLP-1s, work by boosting insulin. But wait a minute, isn't insulin the fat storage hormone? So how in the world can a drug that ramps up a fat storage hormone actually melt away belly fat? It just sounds backwards, but spoiler alert, it works. And we're going to figure out why. So here's how we're going to unravel this mystery. First, we'll tackle the paradox head on. Then we'll look at the difference between a good insulin spike and a bad one. We'll find the real root of the problem. And it's not what you think. Then we'll trace the metabolic spillover, see how these drugs hit the reset button. And finally, we'll talk about why this is a much bigger deal than just losing weight. Okay, so let's get right to it. The reason this feels like such a paradox is that we've kind of got the wrong idea about insulin. The conversation isn't really about insulin being good or bad. And let's be super clear here, we need insulin. It's not the enemy. Think of it like a key. After you eat, insulin is the key that unlocks your cells so they can take in glucose for energy. That's essential. The real problem isn't the key itself. It's what happens when that key is just left jammed in the lock 24/7. That constant exposure, that's the villain of the story, which leads us perfectly to the rhythm of how insulin should work. Because there's a world of difference between a quick, healthy spike and a long, damaging plateau. And you can see the difference right here. On one side, you've got the healthy response. Insulin goes up after a meal, does its job. And then this is the important part. It comes right back down. This allows your body to flip that switch from storage mode to burning mode. But on the other side, that's the problem. Insulin is just stuck on high. It never gets a chance to fall. And when that happens for months, even years, your cells start to ignore the signal. That's insulin resistance. And check this out. This is a perfect real-world example of what we're talking about. It's from a patient's glucose monitor before and after they started GLP-1 mimetics. You see the big jumps after they ate. But look closer, see that baseline. It never really drops down to a healthy level. It's just high all the time, even overnight. That tells you their body is constantly dealing with too much glucose, which means the pancreas is constantly pumping out insulin. So the big question is why? Where is all this pressure coming from? And it's not just about food. The real story, the piece of the puzzle that almost everyone misses, actually starts somewhere else entirely. It probably starts with our muscles. Get a load of this number. 70 to 80%. That is, how much of the sugar from your meal is supposed to go directly into your skeletal muscle. Your muscles are basically a giant sponge for glucose. We call it the glucose sink for a reason. It's this huge, massive buffer that protects the rest of your system. But here's the catch. As we get into our 30s, 40s and beyond, that glucose sink starts to get smaller. Life happens. We might be less active. We naturally lose muscle as we age. And the muscle we do have doesn't respond to protein as well as it used to. All of this means our body's ability to handle the carbs we eat just shrinks. The sponge isn't as big as it used to be, and once that sponge, that muscle sink is too small, that's when the first domino falls. The whole system starts to get overwhelmed, and all that extra energy, it has to spill over somewhere. Okay, quick detour. It's really important to understand that not all fat is created equal. You've got subcutaneous fat. That's the stuff right under your skin. It's like a safe storage depot, but it has a limited capacity. Then you have visceral fat. This is the dangerous stuff. It's stored deep in your belly, wrapped around your vital organs. This is where the spillover ends up. So let's walk through the chain reaction. Step 1, your muscles shrink. Step 2, glucose has nowhere to go, so it hangs around in your blood. Step 3, your pancreas goes into overdrive, pumping out tons of insulin to deal with it. Step 4, your safe fat storage depots get totally maxed out. And then the final domino metabolic spillover. All that excess energy gets shoved into your belly and stored as that dangerous visceral fat. So you see, belly fat isn't the primary problem. It's the symptom of an energy storage system that's completely overloaded. All right, so how do these GLP-1 drugs actually fix this mess? Well, this is the elegant part. They don't just try to force a broken system to work harder. They basically hit a physiological reset button. They launch a multi-pronged attack, really. They dial down your appetite so less fuel is coming in. They slow down digestion so sugar trickles into your blood instead of flooding it. They even tell your liver to chill out and stop making extra glucose. And what's the grand result of all this? The total pressure on your pancreas plummets. The demand for insulin just goes way, way down. And the results, they're nothing short of incredible. I mean, look at this. This is from an actual patient's CT scan. Before GLP meds, their visceral fat was at a dangerous 211. Just 3 months later, it dropped all the way to 123, a totally normal level. This proves it's not just about eating less. This is the body fundamentally resetting itself and finally getting a chance to burn off that harmful internal fat. And this is where the story goes from interesting to absolutely critical, because getting rid of this visceral fat isn't just about looking better or feeling better. It has massive life-changing implications for some of the biggest diseases we face, especially heart disease. To really get how big a deal this is, let's compare it to something we all know. Statins. For decades, statins have been the number one tool for preventing heart attacks. But look at this data. Semaglutide reduces cardiovascular risk by about the same amount. And here's the kicker, they work in completely different ways. That means you can use them together. This isn't a replacement, it's a whole new weapon in the fight against heart disease. And this isn't just a guess. The huge landmark SELECT trial put it to the test and proved it. They took people who already had heart disease, and these drugs cut their risk of having a heart attack, a stroke, or dying from cardiovascular disease by 20%. That is a game changer, but it doesn't even stop there. We now know that this dangerous visceral fat is linked to all sorts of other major health issues, even cancer. And this quote from a huge study really says it all. It's not about how much you weigh, it's about where you store your fat. So let's bring it all home. The insulin paradox. Well, it turns out it's not a paradox at all. These drugs work because they relieve the intense pressure on your metabolic system. They break the cycle of high blood sugar and high insulin. And that finally gives your body the green light to tap into and burn away that deep, dangerous belly fat. It's not magic, it's a physiological reset, which leaves us with one last really important thought. If that slow, creeping loss of muscle is the first domino to fall, what does that mean for all of us, especially as we head into our 30s and 40s? It means that building and maintaining muscle through strength training and eating enough protein isn't just a vanity project. It might just be one of the most powerful things you can do to prevent this whole cascade from ever starting. It's a whole new way to think about long-term health, isn't it?